Okay, so today we're taking a deep dive into something that pretty much every GP out there faces on a daily basis.
Hmm.
Hiccups.
Yeah.
That sudden involuntary spasm of the diaphragm. Patients come in with it all the time. We're all familiar with the harmless kind that comes and goes quickly. But what about those cases that just won't quit?
Right.
The persistent hiccups, or even intractable hiccups. That's what we're going to unpack today. And we're really going to focus on giving you, the busy GP, the tools you need to actually effectively diagnose and manage this surprisingly complex condition.
Well, it's fascinating, isn't it, how something so common can still have a few mysteries surrounding it.
Right. You'd think we'd have hiccups all figured out.
Yeah.
But the more we learn about them, the more we realize there's a lot more to them than meets the eye. So, for instance, we all associate hiccups with the diaphragm, and that's accurate. But did you know that the left side of the diaphragm is actually the main player in about 80% of cases?
That's true. And when you look at the underlying mechanism, that reflex arc we talk about,
Mhm.
it actually involves a whole bunch of different players.
Yeah.
We've got the phrenic nerve, the vagus nerve, even the sympathetic nervous system jumps in.
Wow.
And here's the thing, the central control center for this in the brain, it's not just one pinpoint spot. Research suggests there are multiple areas of the brain that are involved in this whole hiccuping phenomenon.
So it really is more than just a quick little spasm.
It really is.
There's a lot going on. And speaking of complexity, let's
But
talk about why we can't just brush off hiccups as a minor nuisance, especially when they stick around.
Well, I think clinically it's so important to recognize that prolonged hiccups can actually have a really significant impact on a patient's quality of life.
Absolutely.
Think about it. Disrupted sleep, difficulty eating and drinking, even exacerbating pain conditions that they already have. These are real consequences.
Absolutely.
Oh,
And let's not forget about the psychological toll it can take.
oh, absolutely.
Chronic hiccups can lead to fatigue, anxiety, depression. And from a GP's perspective, we've got to be thinking about the potential for malnutrition and dehydration, especially in our more vulnerable patient populations.
Absolutely. So getting that really thorough history from the patient is key. Asking them, how are these hiccups affecting your daily life? How's your sleep, your work, your overall well-being?
Yeah, absolutely. So we've established that hiccups, especially those persistent ones, are more than just a fleeting annoyance.
Yeah.
But now the question is, what's causing these stubborn hiccups in the first place?
Well, get ready, because the list of potential culprits is pretty extensive.
Okay.
We're talking everything from central nervous system disorders like strokes and tumors to GI issues like GRD and even cancers.
So we really do need to think broadly.
You do. And don't forget about thoracic and cardiovascular conditions or medications, metabolic imbalances. And you might not believe this, but even psychogenic factors can come into play.
Really?
Yeah. So that just highlights how important a good differential diagnosis is.
Wow, it really is like a medical mystery, isn't it? Trying to piece together all the different clues.
It is.
Now, before we get too deep into diagnosis and treatment, I think it's worth talking about those classic home remedies that we all know and love.
Huh.
Holding your breath, sipping cold water, all the tricks our grandmothers swore by.
Yeah. And while those home remedies might work for those simple, short-lived hiccups, when they fail, or especially when we're dealing with persistent hiccups, we need to consider a more targeted approach.
Yeah, absolutely. And that's where pharmacotherapy comes in.
Hmm.
And the good news is that we actually have a whole arsenal of medications that can help us out. So today we'll be taking a look at the evidence for baclofen, gabapentin, metoclopramide, and even chlorpromazine. We'll break down how they work and what side effects to watch for.
And for those really tough cases, the ones that just don't respond to anything else, we've got some other options, like alternative therapies such as acupuncture and hypnotherapy, or even interventions that target the diaphragm itself, like nerve stimulation. And in really extreme situations, there are even surgical options that we can consider.
Really?
Yeah.
Wow. Okay, so clearly there's a lot to unpack here, so let's get started.
So when those home remedies just aren't cutting it, and we're dealing with a patient who's struggling with persistent hiccups, those that last more than 48 hours, what's our first step?
Well, that's where our detective work begins, right?
Exactly.
A detailed patient history is absolutely crucial. I'm talking about asking those targeted questions, not just about the hiccups themselves, but how they're impacting the patient's life,
Right.
their sleep, their ability to eat, even hold a conversation.
Absolutely. And don't forget about a thorough medication review,
Oh, good point.
because some medications are known hiccup triggers.
Yeah, that's true. Are there any particular culprits that come to mind?
Well, dexamethasone is a common one, but often you can switch to methylprednisolone and the hiccups might resolve completely.
Ah, so a simple switch can make all the difference. What other red flags should we be looking for in the patient's history?
Well, think about associated symptoms. Are they having any neurological issues? Any GI complaints? Anything unusual happening in their chest or abdomen?
Right.
We're looking for clues that might point us towards a specific system or an underlying condition.
Like putting together a puzzle.
Exactly. And of course, a physical exam is just as important.
Of course.
Checking for things like an enlarged thyroid gland, swollen lymph nodes, or any signs of irritation in the throat, which could suggest GERD.
Okay, so we've got the history, the physical exam, all pointing us in a certain direction. But sometimes we need more information. So when do we start thinking about lab tests?
Well, if the clinical picture isn't clear, lab tests can be really helpful to rule out metabolic imbalances or other underlying issues. A basic metabolic panel is a good starting point.
Okay, so checking electrolytes like sodium, potassium, calcium, along with kidney and liver function.
Exactly. And if your patient is having abdominal symptoms, you might want to add pancreatic enzymes like amylase and lipase to the panel.
Good point. Okay, so we've done the history, the physical, the labs. What if we're still scratching our heads? What's our next moves?
Well, that's when imaging studies can be incredibly helpful. For instance, if there are respiratory symptoms or anything concerning on the chest exam, a chest X-ray is a reasonable next step.
Right. And if we're suspecting a central nervous system issue, we might consider a brain MRI or even a lumbar puncture, depending on the situation.
Exactly. And for GI symptoms, an upper endoscopy can visualize the esophagus and stomach, looking for things like GERD or ulcers.
So sometimes we need to go a bit deeper to get those answers. Now, you mentioned earlier that our approach might be a bit different for patients with advanced malignancy.
Right. That's a really important point. In these cases, extensive testing might not always be appropriate or even beneficial. Our focus often shifts to symptom relief and improving the patient's quality of life.
So in those situations, we might go straight to medication management, even if we haven't pinpointed the exact cause of the hiccups.
Exactly. The priority is providing comfort and relief.
Makes sense. Okay, so whether we've identified a specific cause or not, if those hiccups are persistent, it's time to think about medication. What are some of the go-to medications for treating those persistent hiccups?
Well, based on a 2015 systematic review, baclofen and gabapentin are considered first-line therapies for intractable hiccups.
And if those aren't successful, metoclopramide and chlorpromazine are also options. It's great to have a range of tools, isn't it?
Absolutely. And it's important to understand how each medication works and what side effects to be aware of. Baclofen, which is often used for muscle spasms, seems to work by blocking those nerve signals that trigger hiccups.
So it's interrupting that reflex arc.
Exactly.
Okay, what about gabapentin? Isn't that an anticonvulsant?
It is. And it's also used for nerve pain. It seems to be effective for hiccups by calming those overactive nerves involved in the hiccup reflex.
So baclofen and gabapentin are kind of targeting the neurological side of things.
Yeah.
What about metoclopramide? That's used for nausea and
Yeah.
vomiting, right?
Yes, it's a prokinetic agent, meaning it helps with gastric emptying. So if we suspect the hiccups are related to GI issues, metoclopramide might be a good choice.
That makes sense. And then there's chlorpromazine, an antipsychotic medication.
Right. But it's used off-label for hiccups. It seems to work by blocking dopamine receptors in the brain, which somehow helps to reduce those hiccup spasms.
Interesting. So we've got these four main players: baclofen, gabapentin, metoclopramide, and chlorpromazine. Are there any other medications that are sometimes used?
There are a few others like phenytoin, valproic acid, amitriptyline, or even amantadine, but the evidence for them is less strong, so they're usually reserved for those really tough cases where the first-line treatments haven't worked.
It sounds like finding the right medication and the right dose for each patient can be a bit of a trial and error process.
It can be, and it's important to remember that medication is only one part of the puzzle.
Right.
We also need to address any underlying medical conditions and consider other therapies, like those alternative therapies we mentioned.
Right, acupuncture and hypnotherapy.
Mm.
Those might seem a little unconventional to some, but they can be surprisingly effective for some patients.
Absolutely. And then, in those truly refractory cases, there are interventions that target the diaphragm directly, like vagus nerve stimulation or phrenic nerve stimulation.
Wow. Those are more invasive procedures, but I imagine the relief they bring to patients who have been suffering from debilitating hiccups for years must be incredible.
It is, and these are options we'll explore in more detail when we return. We'll delve into the evidence for those alternative approaches and discuss when it might be appropriate to consider them in our practice.
Welcome back. So before the break, we talked about those first-line medications like baclofen and metoclopramide, and even delved a bit into the world of alternative therapies
Yeah.
for those really tough cases.
Yeah.
Let's dive a little deeper into those alternative approaches.
Sure, let's start with acupuncture.
Okay?
Now, the exact mechanisms of how it works are still being researched.
Yeah.
But there's growing evidence, particularly for patients with cancer and stroke survivors, that acupuncture can actually provide relief from intractable hiccups.
Acupuncture for hiccups. That's fascinating. What about hypnotherapy? That seems even more mysterious. How could that possibly work for something like hiccups?
Well, it's not about mind control or anything like that. It's
Yeah.
really about tapping into that mind-body connection.
Okay.
Helping patients achieve a deep state of relaxation, focused attention, and that can potentially disrupt that hiccup reflex arc we've been discussing.
So retraining those subconscious responses.
Exactly.
That's pretty amazing. Okay, so for those cases where these less invasive options haven't been successful, we mentioned interventions that target the diaphragm directly.
Right.
What can you tell us about nerve stimulation?
Well, vagus nerve stimulation in particular has shown some real promise.
Okay.
It involves implanting a device that sends electrical impulses to the vagus nerve, which, as we know, plays a big part in that hiccup reflex arc.
So it's like hitting the reset button on those faulty nerve signals.
Yeah, you could think of it that way.
What about phrenic nerve stimulation? Is that similar?
It is. So the phrenic nerve is the main nerve controlling the diaphragm, and stimulating it can help to regulate the diaphragm's contractions and reduce those hiccups. There's even a device called an implantable breathing pacemaker that can help to control those diaphragm excursions.
Wow, an implantable pacemaker for hiccups.
Mm-hmm.
That's incredible. We've covered a lot of non-surgical approaches, but are there ever situations where surgery is considered for persistent hiccups?
Well, surgery is definitely a last resort, but it can be an option in certain situations. For example, phrenic nerve blocking with a local anesthetic or even phrenic nerve crushing can be successful in those really tough cases.
Those are some serious interventions. I can only imagine the relief it must bring to patients who have tried everything else.
It really does, and it's super important to remember that before we do any procedure that could potentially immobilize a hemodiaphragm, we need to make absolutely sure that the other one is functioning properly.
Right. We don't want to compromise their breathing.
Exactly. Safety first.
Always. Well, as we wrap up this deep dive, I think it's important to emphasize that we really need to approach hiccups, especially those that hang around, with more than just a "it's no big deal" attitude. They can truly affect our patients' lives and could be a sign of something more serious going on.
I completely agree. And as GPs, we're often the first line of defense for these patients. So by understanding those potential causes, recognizing the red flags, and having a good grasp on all the different management strategies available, we can really make a difference.
It's not just about stopping the hic, it's about figuring out the whole story behind it. And who knows, as we learn more about the human body, we may uncover even more effective treatments for this very common, yet often overlooked, condition.
Absolutely. Knowledge is power.
It really is.
By staying informed, even about those seemingly simple things like hiccups, we can provide the best care possible for our patients.
Well said. And on that note, we'll leave you with one final thought. Could there be a connection between the increasing use of certain medications in our modern world and the prevalence of hiccups? It's a question worth exploring, and maybe it will lead to new insights and even better treatments in the future. Thanks for joining us on this deep dive into the world of persistent hiccups. Until next time, keep those brains engaged.